When the only constant in life is change, you need to be ready. This is the Man-Made Survival Show.
My fellow Americans, tonight I want to speak with you about our nation's unprecedented response to the coronavirus outbreak that started in China and is now spreading throughout the world. Today, the World Health Organization officially announced that this is a global pandemic. We have been in frequent contact with our allies, and we are marshaling the full power of the federal government and the private sector to protect the American people. This is the most aggressive and comprehensive effort to confront a foreign virus in modern history. I am confident that by counting and continuing to take these tough measures, we will significantly reduce the threat to our citizens, and we will ultimately and expeditiously defeat this virus. From the beginning of time, nations and people have faced unforeseen challenges, including large-scale and very dangerous health threats. This is the way it always was and always will be. It only matters how you respond, and we are responding with great speed and professionalism. Our team is the best anywhere in the world. At the very start of the outbreak, we instituted sweeping travel restrictions on China and put in place the first federally mandated quarantine in over 50 years. We declared a public health emergency and issued the highest level of travel warning on other countries as the virus spread its horrible infection.
So we started this broadcast with Trump addressing the nation from the Oval Office 2 days ago. And the main thing that you can get out of this is that he finally acknowledged that this virus is more serious than what it really is. Some people pretty much have some relief, but you should not take it lightly, or you should not just forget about it and say that, everything's better, because it's not. All right. What he said is that he's going to use the full power of the federal government and the private sector. And while he went ahead and he banned the travel from Europe, but not from the UK, coming into the United States for 30 days. So what does that mean? That means that nobody comes from Europe, right? But the bad thing about it is that neither Mexico nor Canada have done the same thing, so they can fly from Europe to Mexico and then from Mexico to the US. Now, Trump is going to give another press conference today, and they have said, or the White House have said, that he's going to declare a national emergency. And what does that mean? That means that Trump is going to have the powers, the emergency powers that he needs to be able to contain this, to be able to do what he needs to as far as being able to contain the virus. Those powers gives him the ability to, take any building that he might use for quarantine, or FEMA, really. The power really comes down to FEMA. FEMA will be able to take any facility they want to and quarantine people in there. They can force a vaccination on you. They can force a treatment on you. They can do a whole bunch of things. And this is pretty much medical martial law. Now, I'm not telling you this so you can freak out, but just so you know, information is what gives you power. It's what gives you everything you need, the tools that you need to be able to prepare or make a wise decision on something that's going to be coming your way. Now, with me saying that, why it's important, and we have to pay attention. We don't know what he's going to say. That's just the announcement they made, so you have to watch it at 3 o'clock today and see what he says. But moving on to this, something that has come out here in the last few hours, it's this headline from NBCnews.com. It's failing. Let's admit it. Fauci says coronavirus testing capacity. And here's that video.
Countless more examples of problems with people getting access to tests all across the country, including in my home state of Florida. We need to have someone in charge of making sure that as many people as possible across this country have access to getting tested as soon as possible. Who is that person? Is it you? Is it the vice president? Can you give us the name of who can guarantee that anyone, but especially healthcare workers who need to be tested, can be?
As I tried to explain to Congressman Green, From the CDC perspective,
Okay, I'm asking for a name. Who is in charge of making sure that people who need to get tested, who are indicated to be tested, can get a test? Who?
yeah, I was trying to say that the responsibility that I have at CDC is make sure all the public health labs have it, and they can make the judgment on how they want to use it.
But they're referencing people who have been advised to be tested to you, and they've been turned down. So is it you?
As I said, I'm going to look into the specifics
I know
of there.
that. So basically you're saying,
for
reclaiming my time, basically you seem to be saying, because you can't name anyone specifically, that there's no one specifically in charge that we can count on to make sure that people who need to be tested, healthcare workers or anyone else, there's not one person that can ensure that these tests can be administered. Yes or no?
My colleague is looking at me to answer. The system is not really geared to what we need right now, what you are asking for. That is a failing.
And failing, yes.
It is a failing.
Very
Let's
much so.
admit it. The fact is, the way the system was set up is that the public health component that Dr. Redfield was talking about was a system where you put it out there in the public and a physician asks for it and you get it. The
Okay.
idea of anybody getting it easily, the way people in other countries are doing it, we're not set up for that. Do I think we should be? Yes, but we're not.
Okay, that's really disturbing, and I appreciate the information.
So you heard the man, right? He is acknowledging that the system pretty much is failing. And, they were asking him a bunch of questions, him and the other person, and pretty much that's why they say that they just make the kits available and it's up to the physician. Well, in Miami, the nurses and doctors are begging for tests and they're not getting them. In California, they are saying that the doctors are getting bad tests from the CDC that, are missing critical components. But he just admitted, it came out of his mouth, the system is failing. The next thing, the worst case estimate for U.S. coronavirus deaths. This from dnyuz.com. Between 160 million and 240 million people in the U.S. could be infected over the course of the epidemic. According to one projection, that could last months or even over a year. That's a long time. With infections concentrated in shorter periods, staggered across time in different communities, experts said, as many as 200,000 to 1.7 million people could die, especially if we see that the system is failing right now at the moment. White House coronavirus experts, Dr. Anthony Fauci says complete U.S. shutdown is on the table and warns that the crisis could last 2 months. This from Daily Mail, but as we saw in the other one, they're saying, 2 months to a year. And let's remember, this election year, now Trump has the power, or will have the power when he declares national emergency, he will have the power to postpone the election. It's not something that is far-fetched, it's a possibility. Fauci said on Friday that the crisis will last for at least a few more weeks and possibly up to 2 months. He said that there is no doubt we have not peaked yet in terms of severity and that it will get worse. Fauci said that he was not sure if the U.S. will reach full shutdown mode, but it's not off the table. There are more than 1,700 people in the U.S. with coronavirus and 41 have died as a result of the deadly illness. Fauci promised testing was going to become more available, but did not give specifics on where or how. And more than likely, that's just going to be on the hot zones like New York, California, Seattle, and, all the major cities probably as well. In California, doctors have been receiving tests from the CDC that are missing crucial components. Until then, the country is being told to be vigilant about this social distancing and staying away from the vulnerable. And, social distancing, that means don't go to a concert, don't go to church, don't go anywhere that there's a lot of people. And New York has banned places that have more than 500 people. So we'll see how that constitutes with, or, how that goes with churches and stuff. President Trump, who has come into contact with several dignitaries and politicians with the virus, had not been tested for it yet, according to the White House. And I have a hunch, we'll see how it turns out, but he might say today that he probably has the virus. I mean, he may not, because that would just freak people out even more. Because Trump is up there in the age-wise. You know, they have said people who are elderly are more at risk. And Trump is, 73, 74 years old? So he's old. So if he catches the virus, then he could be in the percentage of people who very sadly pass away. You know, and they already projected 1.7 million people, worst case scenario. But still, 200,000 deaths, that's a lot. So what does that mean? What does the coronavirus mean for the U.S. healthcare system? Some simple math on the offers alarming answers. This from statnews.com. And I want to thank the people who sent me this information, because I was not aware of this. And see, this network of preppers, if we inform each other, we have a lot better chances of surviving stuff and being informed and not being in the crowd that panics, not being in the dark. So thank you very much for sending the information, because it's very crucial. As of March 8, about 500 cases of COVID-19 have been diagnosed in the U.S., given the substantial underdiagnosis at present due to the limitations of testing for the coronavirus. Let's say there are 2,000 cases, a conservative starting bet, and that is conservative because Idaho just came out and said that they more than likely have 10,000 cases. So we can expect a doubling of cases every 6 days, according to several epidemiological studies. I know I killed that, I'm sorry. It's my English, man, it's my English. Confirmed cases may appear to rise faster or slower in the short term as diagnostics capabilities are ramped up or not. But this is how fast we can expect actual new cases to rise in the absence of substantial mitigation measures. That means we're looking about 1 million U.S. cases by the end of April, 2 million by May 7th, 4 million by May 13th, and so on. And them saying this is not like it's crazy or it's out there, because the mayor of Washington State, he came out and say the exact same thing, that things will multiply very quickly if they did not do something. And he declared his emergency powers. So he has the out of the model of thingy majiggy, I can't remember what it's called, and I don't have it in front of me. But anyways, he has pretty much the dictatorial power to be able to do what he needs to contain this virus. So Washington State has gone into the medical emergency, martial law, whatever you want to call it, and so have other states. If I'm not mistaken, Florida just went into it. The U.S. has about 2.8 hospital beds per 1,000 people. South Korea and Japan, two countries that have seemingly thwarted the exponential cases growth trajectory, have more than 12 beds per 1,000 people. Even China has 0.3 per 1,000. With a population of 330 million, there is about 1 million hospital beds. At any given time, about 68% of them are occupied. That leaves about 300,000 beds available nationwide. And that is going to be one of the ways or the reasons why they're going to send people home. Or they might be the reason why they're telling people to self-quarantine, because they know for a fact right now they do not have the beds for those people. Now, with Trump giving declaring the emergency, national emergency, he gives himself the power, or FEMA gets the power to be able to seize any location, any property, and use it for quarantine or whatever they feel like they need. So don't fight them. Just go along and, roll with the punches until all this blows over. COVID-19, your community and you, a data science perspective. This from fast.ai. And this also another article that somebody sent me. Thank you very much. We should prepare, not because we feel personally at risk, but so that we can help lessen the risk for everyone. We should prepare not because we are facing a doomsday scenario out of our control, but because we can alter every aspect of this risk we face as a society. That's right. You should prepare because your neighbor needs you to be prepared. Especially your elderly neighbors, your neighbors who work at hospitals, your neighbors with chronic illness, and your neighbors who may not have the means or the time to prepare because of the lack of resources or time. And that is exactly how we feel at Amendment Survival. I'm not saying that you should, broadcast or, announce to the world that you're a prepper, because that it could be dangerous. What we're saying is that if you see your neighbor, your elder neighbor, whoever, that they're struggling, and you can come along and help them out, to ease that burden, then not only that you're gonna feel hold on, I got tongue twisted. You're gonna feel good about that, but not only that, it's a good time for you to, share the gospel. If you're a Christian, if you're a prepper and you're a Christian, this is the perfect opportunity, not only to be a good human, but also to spread the gospel, show the love of Jesus Christ, and do what you need to help, other people. Dr. Anthony Pensetti, head of the Regional Crisis Response Unit in a hard-hit area of Italy, said, "We're now being forced to set up intensive care treatments in corridors, in operating theaters, in recovery rooms. One of the best health systems in the world, in Lombardy, is a step away from collapse. This is not like the flu. The flu has a death rate of around 0.1% of infection. And, as I have reported before, they have said that it's 10 times more deadly than the flu." So there we go. That is all for today, but, in this video, because I have a lot of information out here. So I hope you stay all the way through the end and get this information, because this information is very important. The number of cases have exploded, especially here in the United States, now that they're testing, but they're not testing everybody. Imagine if they did. Right now, we sit at 1,714 with, 41 deaths, something like that. But the point is that now you need to limit your exposure. If you have already gone to Walmart, then you need to try and stay away from there as possible. I know you still have to go to work because they haven't declared it yet that it's an emergency in your state or in your city or whatever. But, still be safe, be vigilant. If you can avoid church, don't go to church. If you can avoid going to the concert, don't go to the concert. I mean, either way, they're canceling everything right now. But the point is that now is the time to take it serious. Your window of opportunity is pretty much all the way close. For people who have not prepared yet, you still have very limited time, but you still have time. So listen to the announcement that Trump makes today. We'll see what he says, and I'm gonna try to broadcast it live. I'm gonna see how I can do that. But anyways, my name is Jose Prime Survival. Please like this video. Please share this information, because as you see, this information is very, very important. And the more people know, the less they'll be freaked out, and the more they'll feel more at ease, because they'll know that they're prepared and they have more information that's reliable. But anyways, my name is Jose Prime Survival. Always ready.
The Man-Made Survival Show.